My name is Daniel Xibille. I'm a rheumatologist from Mexico. I have worked as a rheumatologist for over 20 years. I studied medicine in Mexico, and then I did my specialty training in Mexico City. At the academic program was the Universidad Nacional Autónoma de Mexico. And afterwards, I started practicing rheumatology. I got a master's degree in molecular medicine and a PhD in pharmacy later on during my academic development. I have worked in both the public and private areas of patient care in Mexico, and I work both in Mexico City and outside of Mexico City too. I currently am an attending rheumatologist at the hospital I work in, a public hospital, and I also am an associate professor of the rheumatology training program at the Universidad Nacional Autónoma de Mexico. And I've formerly been president of the Mexican College of Rheumatology. I have worked as a translator for the editorial board of Rheumatología Clínica. I publish research once in a while. I'm a member of the National Researchers System, Sistema Nacional de Investigadores, here in Mexico. I'm a member of the ACR, the American College of Rheumatology. So I try to divide my time between public and private care and teaching and research. These past years have been complicated by the pandemic, but right now we're getting into the groove of, patient care, teaching, research, et cetera, et cetera, et cetera. Well, the program is sponsored by Doctors Galaxy to credit healthcare service providers based on focus areas. And these focus areas can be things such as good clinical practices, patient-centered care, effective care delivery, among others. So this accreditation program wishes to ensure or guarantee to a certain degree quality in the information provided in these areas. And besides the accreditation, the program offers a host of other benefits to the subscribers in terms of professional growth. Well, as healthcare professionals, we all need support specific to our area of knowledge or our area of specialty in order to grow within our practice, in order to deal with customized marketing and networking among colleagues. So this obviously provides additional economic opportunities like participation in clinical trials, in research projects, as speakers, or assisting to conferences or presenting our work in different meetings. So this program offers all kinds of support in this sense, and with the experience of more than a decade, well, Doctors Galaxy knows how to do this better than most. It's relevant to all age groups, but I think those that will be more attracted to it will be young professionals who are just getting into the field and need this support that we've been talking about in order to get out there and to get known, and to also advertise themselves among different sets of patients, setting up their offices, participating in referral networks and the such. Well, our existing medical societies offer academic support in terms of continuing medical education. Basically, that's what they do. And they offer some opportunities for networking, basically through their annual meetings. But this is a very limited scope. It's a very traditional scope and limited scope regarding these two areas. So this program, the Doctors Galaxy program, offers professionals with continuous networking, marketing, and financial support to achieve career growths outside of medical societies. So it becomes an essential complementary element. Well, yeah, there's a general committee which has subcommittees according to specialty. So we will be, as specialists, we are in touch with other specialists, the same specialty as ours, in order to reach whatever agreements we're trying to reach. So these committees have a say in the quality and the audit manual related to the specialty, to the accreditation procedures, followed by the general committee, which has an overall management of funds, program rules, etc. But we are in contact with colleagues from our own specialty who work with us through the accreditation program. Yeah, well, I would like to contribute my knowledge and experience in giving a contemporary push to my fellow colleagues and young fraternity members who face a future which is complicated, but hopefully they'll pass with flying colors, solving the issues that they are faced with, and both academically, professionally, and from a financial standpoint. Well, as healthcare gets more and more complicated and we are exposed to more and more options regarding both academia and clinical practice, I believe that this is very relevant and that this is what we need, we currently need. We all want support for career growth, and I believe that this is one of the solutions. It's just not only the number of patients that we receive, but also the logistics of patient care, of the administrative burden that we face when we're managing clinic, and these issues with both young and senior professionals facing it day to day can be shared through this kind of a program, and it offers solutions to most of the issues that we face and to most of the professionals that face these issues. So if something is left out, as a committee, we could try and help out in dealing with those specific problems and building a better fraternity and network among specialists. So I think everybody should be interested in joining in order to improve their own professional capacities.